Hello everybody, I'm Steve. I'm a long-term pituitary patient. Had my surgery 29 years ago. I'm still here, which quite a lot of patients, when I talk to them, are very reassured by. My initial talk was a lot longer, but every time I speak to Dan, he's cut me down. I'm down to 5 minutes now, so if I talk fast, I'm sorry. It's just a basic story. It's probably a lot of you will identify with it. My story starts back in the mid-1980s. I'd been visiting my GP for over 2 years with various minor health issues, which looking back now I realise were in some way related to my acromegaly. My GP at that time didn't come up with any useful advice, and on one visit he even advised me to take more exercise to counteract the terrible pains I got in my knees. By mid-1987 I just knew instinctively that there was something wrong with me, but nothing I could pinpoint. I went to my GP to have a medical for my HGV driving licence, which I passed, and just as I was leaving his surgery, he called me back and said, "Could I have a look at your hands, please?" So I'm thinking, oh God, here we go. And he started writing and he said, "I'm sending you to the local hospital for some tests." He said, "I think you've got something called acromegaly." And of course, back then, in those days, there was no internet, no pituitary foundation, so there's really no way of finding out any information about it. And everybody I spoke to hadn't heard of it. But cutting a very long story short, yes, I went to have the tests. They confirmed I got acromegaly, and I duly got referred to an endocrinologist. He was very good, explained what the condition was, but like many of you, after he'd mentioned that I got a tumour in my head, I didn't really hear an awful lot of what he said to me after that. Fortunately, my sister had come with me, and she took notes, which she filled me in later when my brain had come back. And probably a lot of you have done this as well. I was asked to take in a series of photographs that I could accurately date. They were laid out on the table. The endocrinologist looked at them and he said, "I can see some acromegaly there." He said, "I can't there." Turn them over. And he reckoned I'd had it for at least 7 years. It was at this point that I said to him I was a bit put out with my GP for not diagnosing me. And he just smiled and said, "Stephen, just be glad he did diagnose you." So I felt a little bit more charitable towards my GP after that. I had surgery in February '88. It all went well, apart from a very slight CSF leak. And back in those days, I had the piece of muscle taken out of my thigh. I had more trouble with that than I did with the pituitary surgery. And back then, the hospital stay for me was 10 days. So that's improved greatly as well. And I was very impressed to see the new packing in that, because I was in the days when they put the pyjama waistband cord up your nose, about 20 yards of it up each nostril. And when the nurse took the first one out, it was like almost like Tommy Cooper doing a magic trick. It just kept coming and coming, Everything went okay after that. I eventually went back to work. My growth hormone level started dropping, my IGF-1 started dropping. And then early in 1992, I had a routine appointment and blood test. And that showed my IGF-1 had risen. I had an MRI scan, and that showed that the tumour had started to regrow. So I then underwent the 6-week course of conventional radiotherapy, which did finish off the tumour, I'm pleased to say, over the following years. But as you heard in the talk earlier, it unfortunately finished off what was left of my pituitary gland as well, I think. I've been on hydrocortisone replacement since my surgery, because I don't make any cortisol. But over time, as the radiotherapy kicked in, my other pituitary hormones started going. Thyroxine went first, then my testosterone disappeared, and eventually I've even become growth hormone deficient. So I now take replacement therapy for all of this. So it's tablets, injections and everything else. So overall I've improved greatly since my surgery. As you can see, my facial features have gone back to fairly normal. I've lost the ridges. My lips have thinned down. Still got a big nose, unfortunately. My fingers have thinned down. Prior to surgery, they were getting onto looking like sausages, and I could only close my hand to about there. Now I can close it back to my palm again. So yes, I'm now in remission, and the endocrine team here at the QE see me once a year. And I'm classed, I think, as a maintenance patient now. I go in, they do a quick MOT, stamp my certificate, and say we'll see you in a year. I can't fault the treatment I've had at the QE, I have to say that. So, rounding off, my pituitary tumour, or I should say more accurately, the removal and treatment of it, has left me with medical problems I didn't have before. A lot of you will be in the same boat: weight gain, fatty tissue. The main one for me is the chronic fatigue and exhaustion. That led me eventually to having to give up full-time work. I went part-time, and eventually I had to give that up, and eventually got signed off and went on to benefits. Fortunately, I've retired now, so I don't have to worry about anything. The government pays me every month an old age pension, so I'm happy about that. I do tire very easily. I find it difficult to do normal household tasks. Before all this, I could vacuum the whole house. Now I'm lucky if I can vacuum one room, and then I have to sit down for an hour and recover. And as I say to patients who I talk to, it's important that you learn to pace yourself. It's so easy to overdo it on the days when you feel good, and if you do overdo it, I certainly pay for it the next day or the next 2 days. So I find myself a member of an exclusive club, like the rest of you. It's not one I wanted to join, but now I'm here, I do make the most of it. Over the years that I've been a volunteer for the Pituitary Foundation, I've made some very good friends, people I would not have met if I had had a normal pituitary gland. I've only recently joined the Facebook group, which Dan set up, and I have to say I find that a very good source of information and support. There's nothing quite like talking to somebody who's walking the same road as you are in their shoes. I remember back in 1994 when the Pituitary Foundation started. Do excuse me, my nose keeps running. I don't know if that's another condition. I think it's a CSF leak, yeah. I don't tell anybody in case they have me back in. I went to a launch meeting in Bristol. I entered a room very much like this. There's lots of people standing around talking, and I scanned the room and I saw a group of people, and there was a lady standing there, and I thought, she's got acromegaly. So I sidled over to her. I was a lot shyer in those days. I would never have stood up in front of a room like this and talked to people. And when I got her on her own, I said, excuse me, I hope you don't think I'm being rude, but have you got acromegaly? And she said, yes, I have. I said, do you mind if I talk to you? I said, you're the first acromegalic I've met. And she said, actually, she said, you're the first one I've met. And we chatted for at least half an hour, swapped experiences, and we still talk to each other even now, at least once a month on the phone. So I think probably like a lot of you, I've become an expert in my condition. I think you have to. And I do my best to help others who are starting out on their pituitary journeys. Over the years since my diagnosis, I've seen, and the talks today have shown as well, that there's been lots of advances in both surgery and drug techniques. And I think if you're going to have acromegaly, now is probably a very good time to have it. So just rounding off, these days my life is a balancing act, but I have great support from my family, friends and the pituitary community. Over the years I have reached an uneasy truce with my pituitary condition, and in all honesty rarely a day goes by that I don't wish for a magic cure that would give me back a normal life. Thank you for listening to me.
Thank you, Steve. That was excellent. Right, Lauren, I think, is that
Yeah.
okay just for a couple of minutes?
Yeah. Can I put this on?
Yeah, or you can talk about that. It's up to you.
Hi. So in December 2014, I got back from being away for like about a year and a half. And my mum said, something's weird, you're not right, you look different. So trotted into the GP with my mum. She talked the lady into sending me for bloods. I was 24 then, I'm 26 now. Went for my bloods, came back, my prolactin was not good, so she sent me to see my local endo in Dover and had to wait a while. So Jan 2015, walked into the room very quickly, a few minutes. He was like, right, have you heard of acromegaly? And I was like, well, of course not, what's that? Give me a tablet and I'll be fine. And he said, can I see a picture? So I got one of my old pictures out and he was like, yeah. Okay, so went for my MRI and OGTT at Ashford. He greets me outside my MRI. I had my OGT a few days before, and was pretty sure that I had it then. And he referred me to King's College Hospital that day and just asked if I'd go down to the lab in the hospital at William Harvey because they'd never seen bloods like mine, so special. So soon after, I went to King's College Hospital to meet Dr. Alwyn, and he does my bloods and put me on lamotide immediately, and kind of sat me down in that room. So weird. He said, right Lauren, these things come small, medium and large, and you have extra large, extra extraordinary. It's like brilliant, right? So he kind of got it up and he was like, it's 7 centimetres. And I was like, right, I didn't know these things are meant to be small. Didn't know. So yeah, pretty quickly I had my first transvenidal surgery. Mr. Thomas at King's did all of them. And yeah, my first one up the nose in March 2015. April 2015 I had my first craniotomy. The operation went well, but I kind of a bit poorly after. I didn't recover too well. I had seizures and stuff, and in between I had third nerve palsy. So like some of you must have had that. So that kind of shut my whole face off, and that was strange. And then I had my second craniotomy in May. Kind of was out of it for quite a long time. Waking up, kind of realised like what's going on, like couldn't get my eye to work, and that's when I realised I'd gone blind in that eye. But you know, I can still go the other eye. I'm fine. I've got my driving licence back now, so I don't see it as a big problem. You know, it could have been a lot worse. And I continued on lamotide. And in the September of 2015, I had radiotherapy at St Thomas's for 2 to 3 months, 5 days a week. And while I was having that, Dr. Alwyn was applying for me to go on Pacirotide, which at the end of the radiotherapy, I'd found out that the application had been refused, which was a real hard thing to take. So my family and I had to appeal. My mum and dad and I kind of wrote a letter. And then a few months after, they said, okay, Lauren, we think you deserve it. With all this time, I was on the lanreotide, and after my surgery and radiotherapy, my IGF hadn't dropped. At first, it was about 700, 800, and it wasn't really budging. It was still about 500. So I got the funding in the end for pocireotide for 6 months. And it worked incredibly. Like, we looked at the graph yesterday, Dr. Alwyn and I, not yesterday, last week, and it had dropped incredibly, which was great. It was so obvious that it has been working good. After the 6 months, they wanted proof. The NHS needed proof, which is obviously it's a good thing. They need proof before handing out me more money for the funding, and that took 3 months to do that, for them to kind of revise the proof, and in that 3 months my IGF had kind of shot up to more than it was before I even started the pocireotide. So that seemed like a complete waste of time, that 6 months, me trying to help myself and the medication. So in the March, I think it was, I got a year worth of funding for pocireotide, and I'm still on that now, and it's looking good. Yeah. So yeah, March 2018 it runs out, and I saw Dr. Alwyn last week, and we looked at it on the graph, and it couldn't be more obvious if it wanted to be that it's working for me. And I'm waiting for my genetic results. I went to Guy's a few months ago, and I'm waiting for that back now, and another MRI in September. My MRI last year was encouraging. It showed that my tumour hadn't grown, and maybe the radiotherapy I had was keeping it small. So yeah, that was good. I think that's it really. Probably not it, but
I think that's enough for most people. Lauren, that's brilliant.